Hi, my name's Rosa and I'm here today with my colleague Rachel.
Hi.
And we're both clinical thermographers and we're from Medical Thermal Imaging. Now, we work a lot with women with breast problems, so today we thought we'd give you a few tips on breast cancer prevention. Just very simple things that you can do to improve not just your breast health, but your overall health. So today, we're going to be talking to you about dry body brushing. From our clinical practice, what we've found is that when women do dry body brushing, especially where they have lymphatic congestion under their arms, we tend to see a big reduction in the inflammation under the arms. And this really does improve the overall health of a person.
So we're going to demonstrate the body brushing technique on Rosa today. The brush that I'm using is a natural thistle brush, and you can buy them at any good health store or any good chemist. And what we're going to do is we're going to start from the feet and work upwards towards the heart, and anything after that we're going to do from the head, always working towards the heart. So starting at the feet, we're going to do the bottom of the feet. So I just lift Rosa's leg. So we're going to do both ways to give it a good shift, and the final stroke towards the sole. Then we're going to work upwards, the top of the foot, light gentle movements, up towards the thigh and the inner thigh, working towards the groin where we've got lots of lymph nodes. If we can do around the hip area, on women you can tend to get fatty deposits around this area, so you can give it a good shift and go both ways, and your final stroke towards your lymph nodes to push all the excess tissue. Now when we get to the abdomen area, we're always going to work in a clockwise movement, going with the bar. Okay, so
It feels great as well.
Is it?
Yeah, it's fun.
So when we get to the sides of the body, we want to be working in upward strokes. Because women tend to wear bras and underwear bras, things can get a bit congested under this area. So we're working in upward strokes. We're going to work on breaking down toxins under the arm. And obviously you'll be doing this when you don't have a bra on. And your final stroke towards your lymph nodes under your arms. Again, working towards the underarm to the lymph nodes. Now when you come to do the backs of the arms, you can lift the arm up, and you can do quite harsh strokes on the backs of the arms because they can tend to build up again, fatty deposits and toxins build up in this area. So you can actually give it a couple of strokes each way, but again your final stroke towards your lymph and under the arm to drain. And this also helps to tone the arm, tone the skin and the appearance, as well as remove all your dead skin cells. Okay, so when we come to do the backs of the legs, an area again builds up with women. Toxins tend to get cellulite builds up on this area. So your strokes upwards again. Now on this area you can be quite harsh, and again if you want to you can do your double strokes each way to give it a good shift, and then your final strokes towards the lymph and under into the groin area. Now with the buttocks you can do, obviously you have no underwear on, you can do round strokes on the buttocks, again giving it a good shift, and your final stroke round towards your groin and help drain all that round to that lymph node. We're going to do the back, but again round the waist area, the tops of the hips, they tend to build up with women. So what you can do is you can do double strokes, give it a good shift round, and your final strokes round towards the groin. And your back, let's work upwards now, strokes up towards the heart area. And you'll have lots of lymph nodes under your arms as well, so we're working to drain all that off. Now the top of the back, I'm just going to do some light strokes up to the top of the neck. And you can even do the top of the neck if you're gentle, and that stimulates the immune system up there as well. When we get to the chest area, what we're going to do, I'm going to give Rosa the brush and show her how to do the breast area herself, but I'm just going to show you how to do the underneath area. So when you take your bra off, Rosa, if you just lift the breast area up there, and what you can do is this stomach area can tend to get fatty deposits as well. So again, you can go both ways and then help to drain towards the lymph. So give it a good scrub both ways and then help drain towards the lymph area. So if I just give you the brush, Rosa, and just show you, heavy breast as women, you may need to lift up the breast area so you can get underneath the breast to give it a good brush. So that's great, yeah. And then the tops of the breast as well, very gently.
Well, I must say, girls, that actually after that, just feeling that, you feel absolutely fantastic. I know I've been dry body brushing for a long time, and both Rachel and I tend to do a double whammy with it. We get those exfoliating gloves as well on when we get into the shower, and we do our bodies, of course, with natural shower gel, not with a chemical-based one, and we start on the body and do it all the way up again. So it is, it really is, yeah. So Rachel, you know, for all our ladies that have had mastectomies and lumpectomies or any kind of surgery, how long would you have to wait before you dry body brush the area?
You would need to wait 3 months really before, so let the area heal. But if you're in any doubt, then you can consult your doctor.
Okay, and then you mustn't do this on broken skin, must you? Or
Definitely not on
anything
broken
if there's a
skin.
rash.
No,
Yeah.
recent scar tissue.
Okay.
The area must be healed.
Okay, and ladies with fungated breasts,
Yeah.
we wouldn't advise anything like this,
No,
would we?
no.
We do more the hot compress and things like that.
Yeah.
This does feel very harsh.
Yeah.
So is there anything that a woman can use maybe on an area where there's a scar that might be a bit softer than
Yes. Well, they do, these softer brushes are on the market. They're a facial brush, so they are a lot softer.
Yeah. Oh yeah, they're much softer, aren't
So you can use them on the face and the breast area, any delicate areas basically. The brushes need to be quite thistly because, you know, they are shifting the toxins around, so they do need to be bristly. I always finish my skin brushing with a nice massage, whether it be an oil or a lotion or a cream, as long as it's a natural one, because your skin pores are going to be quite open after all this. So my big fan is Willida, the Rose Body Lotion, which I'll show you how to put on. Again, just some light effleurage movements, and you can do it as if you're massaging the skin. It's quite soothing for the skin as well after being brushed. The skin is like a sponge, so it's going to absorb anything that you put on, especially after your skin brushing.
Yeah, and isn't it that 60% of what you put on your skin goes into your bloodstream, so it's really important, girls, what you are putting on your skin. I mean, Rachel's a lot younger than me, I'm nearly 50, so I like this, it's Alba Originals, and I actually met the lady who makes this, and she's very proactive with women with breast cancer, and that's what I liked about her. But she does a lot of products, you know, for people that have had chemotherapy and that sort of thing as well. I like this. It's a bath and body oil, but it's absolutely fantastic. So I find this is much better because my skin's quite dry. So I do use this product quite a lot. When I was diagnosed with breast cancer 6 years ago, I really hadn't taken much time to think about my breasts at all and how important they were to me. So what I try to get women to do is actually love their breasts. Rachel and I speak to our patients and we tell them to say this little saying to their breasts every day when they're stood in front of the mirror before they get in the shower, and it's, "Girls, you're safe in our hands."